Hi everyone, it's Marie here, and I wanted to do an update about my total knee replacement experience. So, I know it's only been 2 or 3 weeks since I made a video, and I hadn't made one in a little bit. And so, I just want to kind of get on here and tell you guys an update, what's going on. So, last Friday I went to therapy, and they discharged me from therapy. I had been in therapy, I think, 3 times, so they had restarted me twice since my surgery, since August the 14th. And he said, well, you've got 2 more sessions, but he said, I really don't think 2 more sessions is going to do anything. So they measured me and they made me go through a series of tests, and I measured at 105. So they discharged me from therapy, so I won't be going to therapy anymore unless otherwise they tell me otherwise. I don't know, but right now I'm not going back to therapy. So, it is what it is. I'm at 105. I am able to do some things a little bit better than I was. I still have some trouble, like I still have trouble getting in and out of the car. Still have trouble, if I'm out walking, I have to use my cane every now and then because, if I get unsteady or something. And plus, because of my eye, I had a stroke in my left eye, so it's hard for me to see, and my depth perception is not right. And so I get out of balance sometimes. But other than that, I mean, I can walk pretty good inside without my cane. Still having a little bit of pain in my leg, not a lot of pain, comes and goes, just a little bit. I'm able to get inside the tub shower, but it's still hard getting in and out, but I'm able to get in and out. I can't get in the bathtub part. Have to stand up, take a shower only, or sit down on a bench and use the bench, which to me it's harder to use the bench because to me it's low down and it's hard to hang on to the railing to sit down that low. But then once I'm on it, I'm okay, and then all I gotta do is lift my legs over the tub part and slide myself over and turn around to get out of the tub. And getting out of the tub or getting out off of the bench part is not bad. So, chore wise, I'm able to get up for a little while, but I can't be on my legs very long. I probably can be on my legs about, I want to say about roughly 25 to 30 minutes, depending. But I'm pushing it at that. And then I have to sit down. I still have lymphedema. Not as bad. Still have some swelling, but my right leg is not as big as it was. The scar itself has healed up pretty good. No problems with that. It's still a visible scar though. It's closed, all closed. No bruising. I still have some numbness around the kneecap and around the knee part. It itches every now and then. That's to be expected. There is some stiffness in there, and when I first get up in the mornings, it's stiff. And if I sit too long, it gets stiff. I'm still having trouble like getting in and out of like where I'm sitting. Sometimes I have to have help getting out of chairs or couches or whatever, and sometimes I just have to work my way out and stand up, and it takes a little bit. And I use my cane to help do that. And sometimes I need my walker, to get my stability. And I've been having though pain in my left shoulder with arthritis, and I can't raise my left arm up over my head or anything. And my hand hurts me too in my left hand. And so like I can't raise this arm up. So anyway, I'm back on pain medications because of arthritis. It's not that I want to be, but it's I have to. It's a long-acting medication, and but anyway, I'm back on that, and it is what it is. I am filing for disability. I'm not saying if I'm going to get it or not because I don't know. I know that I can't go back to doing the work that I was doing. I was a nurse working on a floor. Can't work on the floor anymore. I can't. There's no way I could pull and tug on patients right now. There's no way I could lift. There's no way I can be on my feet very long, and I'm tired a lot more. So this has affected my chronic fatigue quite a bit. And I get more tired too with the pain and arthritis, and and I could only do chores for a few minutes and then have to rest, and I have to take frequent naps and things like that. You know, um, and then having diabetes with chronic fatigue with this arthritis, it's quite a bit on a strain on your body too, and it's not easy. I'm not saying it's easy. I am able to drive, as you can see. I'm in my car right now, but I can't be in my car very long. That's another thing. I can't sit very long in the car. It hurts. Can't drive very long. It hurts. Uh, so, yeah, I mean, because it hurts, like when I have to push the gas and push the brake, and pushing the brake mostly. But if I sit very long and it starts to get stiff and it starts to hurt and gets in pain, that's what hurts. And it feels like the band around your knee again and all that. And that's what hurts. And then it starts to swell if I leave it dangling too long. So that's another issue. But yeah, so that's kind of where I'm at. Still doing, like I said, a few chores, able to do a few things, not a lot. Able to drive, but can't sit very long. Can't be in one position very long. Still trying to do my exercises, even though I'm not going to therapy. Like the heel slides, leg lifts, things like that, side leg lifts. I do practice going up and down on sidewalks and things. I don't go up and down stairs because I don't have to use stairs where I'm at. If I have to use stairs, I'd have to be with somebody, or they have to be with me, and I have to have my cane, and I have to have 2 side rails to hang on to. So mostly I will probably always avoid stairs, which I avoided stairs since 2010 anyways, because of my left leg. My left leg is bad with arthritis, and it's bone on bone. So the main thing is, conclusion is, arthritis is bad. It can get very bad. And to me, it's kind of like cancer. It eats away at your bones, and it's kind of like cancer. But it's very slow. Very slow. And then all of a sudden, you can become disabled. And because I always thought my right leg was good, but I was very fooled this year. Really, very fooled. Yeah, I always thought it was my best leg. And now, since I've had surgery, it is my better leg. So, and I have, degenerative joint in my spine and a curvature of the spine. I have other issues. So, I'm not just dealing with just arthritis. But anyway, I wanted to do this video real quick. Just to kind of let you know where I'm at and where I stand. I may not do another video in the future about my knee replacement experience. So I may or may not. I may do a question and answer, or just a update video later on of how my life is in general. So yeah, I'm not working, not able to work right now. The doctor didn't release me, but the therapist did. They said there's nothing more they can do. They can't get it to bend any further, and it is where it's at. So, if you're going through this, I hope and pray you have a good experience. I hope and pray that it fixes a lot of your problems. I can't promise you. They can't promise you. The doctors can't promise you. Yeah, you will have to do the work after you have the surgery. Yes, you sure will. That's one thing. Just keep that in mind. But everybody's different. Keep that in mind too. I know of a patient that was released when she could only bend at 90. I know a patient that was at 120. I know some that were at 115. They were hoping that I would be at 115 to match my measurement on my left leg, which is what my left leg is measuring at. So it's not even at 120 either. So, but she said 105 is not that much of a difference from 115 anyways. So, and I remember before I had the surgery, the doctor saying, just know that we're doing this for pain. We're not doing this for your range of motion because your range of motion is not good anyways. And we don't think you will get all that back anyway. Just know that you may be not able to move it as much as you did prior to surgery. He said we have no guarantee. So, that's where we're at. Sorry about the noise. I am by a busy street today. A busy street. Anyway. But that's where I'm at, and I wanted to do this, and thank you guys for following me along and watching my videos. And like I said, if there's anything I can answer for you, you have a question about or anything, just let me know. Yeah, so that's my experience, and that's all I can tell you. Just taking one day at a time. So anyways, I do wish you all, I hope you guys are well. I do wish that and hope that you guys do okay with your surgeries and all, and therapy and everything. You do need to consult your physicians and your providers and your therapist, and your surgeons. But yeah, it's a journey, and just know that I'm still not healed all the way either, not on the inside either. So, could it bend a little bit more than what it is? Maybe. We'll see. If some more inflammation, is out of that area and it's not as swollen and all that, could I bend a little bit more? I don't know. Maybe. Maybe not. We'll see. But I do know I will have pain and swelling and things like that, and I'll always have stiffness and things. But they said I would have pain and swelling for about a year to a year and a half afterward. One person said 6 months, everybody else said a year, and then somebody said a year to a year and a half. So, I don't know. We'll see how it goes. Anyway, that's all of this video. Thank you guys for watching. Please like, share, comment down below, and hit the notification bell so you'll be notified of all of my upcoming videos if you are on YouTube. And I will share this probably on other social media. But anyway, that's it for now. Bye-bye.